Okay, it's working.
Oh, it's set up automatically. Perfect. Okay. I'm gonna go to the YouTube page and just make sure that it's showing up. It should be.
It's working.
Oh, it's set up automatically. Perfect.
Yeah,
Okay.
you're
I'm
on
gonna
live
go
on
to the
YouTube.
YouTube page and just make sure that it's showing up. It should be.
It's working.
Oh, it's set up automatically. Perfect. All right.
Yeah,
Yeah.
you're on live on YouTube.
YouTube page and just make
I
sure.
can still hear your audio, Emmanuel.
I'm hearing
looping.
echoes.
Voices are looping.
It's set up automatically. Perfect. All right.
Do you want to clear the YouTube?
You're on live on YouTube.
YouTube page and just make
I
sure.
can still hear your audio, Emmanuel. You gotta X out of that, Emmanuel. I don't know if you still have the tab open. Okay, you're quiet now. Good. Okay.
Because he's muted, but he still has it open.
Yeah, so just Emmanuel, make sure that you're either X'd out of that tab or the live stream is muted next time you pull it up. Because we could hear all that.
Now that we know it works, I think you can just close it.
Yeah.
Why don't you unmute just so we can make sure you.
Yeah.
I think I know what to do. I mute the live streaming so I don't hear from there. All right.
Okay.
Exactly.
I think we are good. And I don't even need to watch that one. I need to watch Amy. That's all.
All right.
Trying to make it fun. That's all.
Are we ready to get going? Because we have 5 p.m. I have 87 people in the waiting room.
And
Okay.
we are ending at 7, right?
Yes.
Okay.
Correct.
It's not sooner.
Yes.
Okay.
No. All right. I'm going to start letting people in here. Hello, everybody.
Hello.
Hello.
Hi,
Maddie.
Hi. Is that Yolanda? Did I hear Yolanda?
You know it.
I know I did. How's everyone doing?
Good.
Good. All right, you guys, we are going to start up in just a minute here. We're just going to give people another minute or so to join us, but thank you all so much for taking the time out of your evening to be here today. So just a couple quick things. I will let everybody know that we are recording today's session. So if you have to leave early for any reason or have to jump off, you'll be able to access the rest of the recording later. We will ask also that while we present, you just stay muted out of respect for our speakers to make sure we can hear them clearly. I hear someone in the chat say, I can't hear anything. Make sure that your audio is connected. I guess if you can't hear me, then you can't hear me saying that, actually. All right, welcome to everyone that's just joined us. We're going to get started in a minute or so. Just want to make sure we give everyone time to join. All right, I think we can go ahead and get started here. For everyone that's just joined us, I want to say thank you all so much for taking time out of your evening to be here today. We really appreciate you taking the time. I'll repeat myself here. We are going to be recording this session. So if you have to leave early for any reason, we will record it so you'll get access to listen to the rest of it later on. I'll also ask that you guys all stay muted while we have our speakers talking and presenting, just so that we can make sure we can hear them properly. They're going to be presenting some slides, which I will also share with everyone afterwards. So if you miss any of it, don't worry, you'll get access to it as well. Like I said, I'm going to just go ahead and start the recording here first. All right, there we go. And so we're going to start with a presentation and then go to a Q&A. So if you guys have questions while they are presenting, just put them in the chat and we'll get to them afterwards. All right. Just to get started, I want to do a quick round of introductions. I do know a lot of people in here, so it's great to see all of my familiar faces. For anyone who is new or have not had the pleasure of meeting, my name is Maddie Crudell. I'm a Career Development Program Specialist with ABN. And if you're not familiar with ABN and the work we do, we are a nonprofit based in Massachusetts that assists skilled immigrants, so people with foreign college degrees or work experience, in reestablishing their careers here in Massachusetts. We work not primarily with, but with a lot of people that are foreign trained medical doctors. So the Physician Pathway Act is a really important law for us and the people that we work with. So I'm excited for you all to learn a little bit more about it and learn about some of the recent implementation updates. So people here might have been at our last info session that we did about a year ago, I believe. This is going to have some new information and some new updates for you guys. So we're very excited to share that. And I think I am just going to go ahead and pass it over to Amy and Rob from Mira to let them introduce themselves and start their presentation.
Thanks, Maddie, and greetings, everyone. It's great to see all of you. My name is Amy Grunder. I'm Director of State Government Affairs at the Massachusetts Immigrant and Refugee Advocacy Coalition. MIRA is a statewide organization that works to advance the rights and opportunities for immigrants and refugees, mainly in Massachusetts, but also in other states. And we are also the organization that led the campaign for passage of the Physician Pathway Act back at the end of 2024. And I also had the honor, none of this would have been possible without my colleague here, Dr. Rob Marlin, with whom I served on a government a government commission to explore options from which this bill emerged. And a lot of that I would say it has everything to do with Dr. Marlin, who provided the framework for it. So with no further ado, I'll turn it over to Rob.
Thanks, Amy. So I'm very glad to see everyone, and I recognize that our update is long overdue for many, and we will explain why it's taken so long and hopefully give you some information about what is going to be happening with the Physician Pathway Act going forward. So as Amy said, we served together and developed the act out of the State Commission. So I'm a practicing primary care internist, and my interest is to see so many of you have the opportunity to put your training and credentials to good use for everyone in the state. Next slide, Manuel. I think we can, yes, go ahead.
Yeah, so let's just start. So we're going to start with we'll try to keep the overview brief, just to review what the law actually says. And then we'll move on to the policies that the board has issued for implementation of the new law. So the Physician Pathway Act mobilizes the expertise of experienced internationally trained physicians in order to address physician shortages here in Massachusetts by creating a pathway to full licensure in exchange for at least 3 years of medical practice in an underserved community. Next slide. Okay, so under this new law, there are 3 steps to full licensure. Initially, there's eligible internationally trained physicians can apply for a renewable 1-year limited license to practice medicine under the mentorship of a participating healthcare center or hospital. More about that in a minute. And once that 1-year term is completed, the internationally trained physician will be eligible for a renewable 2-year restricted license to practice in a shortage area or specialty anywhere in the state, not just at that participating healthcare center or hospital. And on completion of that period, step 2, we'll call it, the internationally trained physician will then be eligible to apply for a full unrestricted license to practice. Can you go back up again? Sorry. To practice anywhere in the state. What I wanted to point out, if you could reverse back to the original slide. Yeah. What I wanted to, yeah, I think before that slide too. And before that slide. There we go. Okay, very good. I think what's important to mention here is when we're talking about a limited license, we're not talking about it in the way that we usually talk about limited licenses. There's no limitation to scope of practice during this mentorship period. None at all. The mentorship is not a mini residency. It's not designed to replace a residency. The mentorship is to familiarize the physician with Massachusetts practice. And then same thing is true for the restricted license. Again, it's not a restriction in scope of practice. It's a restriction to a geographic area or population that needs access to physicians, that has that would be a shortage area. And again, and also it's important to note that the physician has to practice not just in a shortage area, but also in a shortage specialty. Each of these licenses can be renewed once, so you've got anywhere from 3 to 6 years on this pathway. Go ahead, next slide.
So the key differences, if any of you, and I'm guessing most of you, have looked at the license requirements for the state of Massachusetts, for the Commonwealth, the key difference, these are all, for the most part, things that everyone has to do. The key differences for this program are you have to have been accepted by an institution who's offering you employment as part of the program, and you do not need to have completed a U.S. residency. That's the key. That's the heart of the law, really, is that requirement has been removed. So again, the new advantage for everyone is you don't have to have completed a U.S. residency. And what you have to do, besides what everyone else has to do that's listed here, is you have to find an institution who's willing to take you on as an employee, not as just a trainee, not as, someone to be mentored only, but as an employee. And we'll get to a little bit more about how that's going to happen. Next slide. So again, as Amy mentioned, the second part of the license, the first part of the license is you're operating at the institution that you've been affiliated with. The second part of the license is you don't have to be at that same institution any longer, but you still have to practice in an area designated as an area of need by the state. And that's really the key. Again, your practice is full scope, that's unlimited, but it's where you're practicing that is controlled by the state. Next slide.
So a little bit more about the mentorship program here. As Rob just said, it's an alternative to residency. It's not intended to replace a residency or be any kind of limited, smaller residency program or mini residency program. I think, Rob, you just covered it. What's different here is, so during the mentorship period, the participating healthcare facility, what their job is to develop and evaluate the internationally trained physicians' familiarity, again, with non-clinical skills and standards appropriate for medical practice in Massachusetts. And the law also defines what kinds of facilities can participate in the pathway. They have to be a federally qualified health center, community health center, community behavioral health center, hospital, or other healthcare facility approved by the board. And this is kind of the service requirement, if you will, of the law that's putting doctors where they're most needed in the state. Next slide.
So this is where we want to give you some new information. And we fully recognize it's a bit frustrating. The law passed a while ago. It was enacted a while ago. What's happened since? So there are many steps that have to happen before this program is in place. And one of them is the Board of Registration in Medicine. That's the agency that's part of the state government that actually gives out medical licenses, had to come up with its own policies to figure out how would they do that. And we've been in discussion with them for quite a while, and they set out their initial policy around this program back in November. And probably this is most important. So they have policies, as Amy mentioned, for the facilities. So they have to be in shortage areas or be serving underserved populations according to the state. And they have to be in one of the categories that Amy mentioned. So it's not going to be that a single physician in a private practice is going to be able to sponsor internationally trained physicians in this program. You may have heard about other states that do that. Massachusetts is opting not to do that for many reasons that we can discuss later. We think this is an advantage to internationally trained physicians because you're going to have a more robust experience than if you were with a single physician in their own practice. So what are the requirements for you all to apply? So the most important ones you will have already done. You must meet the requirements that we've already gone through. That's not new. And again, applies to everyone. And you must have had previous practice experience in an area corresponding to primary care. And that includes internal medicine, family medicine, geriatrics, and pediatrics or psychiatry. And that wording is very important. So we know that in many countries, primary care, as described in the US, is not a specialty. So you may not have gotten a certificate or specific training that was called primary care. But as long as it looks like primary care, as long as that was the content of what you learned, that's fine. Don't worry. You don't need to have a document that said you were licensed in primary care. That's okay. And also, as we were saying, and this is not new, this basically exists for most people, but we're going to have a specific agreement between the institution, so the healthcare center or the hospital, and the internationally trained physician. So it's going to happen pretty much all at the same time, but there has to be an employment agreement, and then together the healthcare facility, healthcare institution, and the physician will go to the board and be able to say, Dr. X or Dr. Y is going to be working at healthcare institution Z, and let us show you together our documents proving that. And then the Board of Registration will both review the application for the individual physician license and the application for the institution to participate in the program. And we'll talk a little bit more about how that will work. But basically, you're going to be working with both an individual institution and the state agency pretty much at the same time. Next slide. All right. So what are some of the specific requirements? Again, in terms of clinical training, we've gone through that, and it's nothing new. It's nothing new in Massachusetts. It's nothing new for anyone applying for a license. So, and I want everyone to listen carefully to both how I'm going to explain this and how to understand it. The reason we wanted to go through the policies for the Board of Registration in Medicine is they are not easy to understand. And that's not because they're trying to be confusing. Because in essence, they have developed policies that include internationally trained physicians for the PPA program, the Physician Pathway Act, but they can't have exclusive policies. And I'll try to explain that a little bit more. So If the policies sound confusing, the reason is because it has to include all possible physicians. So one of the requirements is something that's called recency of clinical practice. And that means that the Board of Registration is looking for ITPs who have engaged in clinical practice within the past 24 months. Now, before everyone, takes a deep breath and is very worried, that's just one way to be entered into the program. Okay, we recognize very fully, very readily that most people will not meet that requirement. We know how difficult it is to go through this whole process, and very few people could do it in 2 years. Okay, but again, because they had to write the policy so they applied to everyone, not just internationally trained physicians, that's why it's written this way. So for internationally trained physicians who do not meet this deadline, meaning you have not practiced clinically someplace in the past 2 years, there's an additional requirement. And what I want to explain is the additional requirement is of great benefit to you. Okay. That is the program that we're going to talk most about during this session, what we call the curriculum. So the mentoring program, you heard us refer to it different ways. So if you have not practiced within the last 24 months, you're going to have to meet the requirements of the board in one of many ways. And we think the best way for everyone to do it, and that even people who have practiced within 24 months should and will do this, is participate in this mentoring program, in this curriculum that will likely be almost the same at every single institution. Okay. Next slide. So again,
Dr. Marlin?
this,
Just
yes.
sorry. Could you just say a little bit more about because I think I heard you say that the mentorship program, it's required for everyone, first of all. The mentorship program is, but then there's this recency requirement. Could you say a little more about how that might play out in the context of the facilities assessment and evaluation program? Like what makes it different?
It's not really different. This applies to any physician applying for a license. So basically, the policy states if someone has practiced within the past 2 years, they meet the criteria of the board for licensure. However, in order to be accepted at an institution through this program, you will have to agree to participate in the curriculum, the mentoring program. So in essence, it does not matter if you meet the criteria having practiced recently or not. If you're accepted into the program, assume you will have to participate in the curriculum, in the mentoring program, which again is of great benefit to you because it is not a clinical program. As Amy said, it's not a mini residency, it's not a regular residency. It's to learn how to practice in this state, in the US, which is going to be different from where you practiced before. So again, despite what the policy says, because it has to meet guidelines for the licensure policies for everyone in the state, whether you have practiced within the past 2 years or not, if you're accepted by an institution and by the state licensing board, assume that you will be participating in this curriculum, no matter what. Does that make sense?
Yes, I understood that the curriculum is required by the law. It's not, either way. And it's for the physician pathway physicians, and that the recency requirement is for everyone. Is that another way of saying the same thing?
I think it's another way of saying the same thing. Yes. Yes. Let's see. So that's the big formal update, meaning these are the policies that the board has passed. We want to go through them a bit more. So for one again, I encourage you all to read the policies, and on the slide that's up right now, there's a link to the state policies. but I wanted to be able to explain them to you a little bit first because, as I said, they can be a bit confusing, and you have to remember they have to have policies that apply to everyone. So if you don't meet the recency requirement, if you have not practiced within the past 2 years, the Board of Medicine will say you have to participate in some kind of program in order to get up to speed. And as we said just now, it's a little confusing because everyone will participate in this program. And what it's going to include are many of the things that you may have heard ACGME, so that's the Association, the Advisory Council for Graduate Medical Education. That is the organization, I know it's a little confusing, they manage residencies in the US, okay? They are not managing a residency in this case, but the board is looking to their benchmarks, their guidelines on some of the key things that people need to know in order to practice, but it does not include clinical areas, okay? And we can go through a bit more about what ACGME is looking for, but basically they have certain pillars, including professionalism, ethics, population management. These are areas that they want every physician to be comfortable with, and the board wants every physician to be comfortable with. And these are areas that will be covered in the mentoring curriculum, in the curriculum as part of the Physician Pathway Act. So again, it looks confusing, but this is a way that the board relatively quickly was able to come up with policies for this program that meet the requirements of existing policies in the state. So again, you have to read the policies, and I hope you will, understanding that and understanding where they apply to internationally trained physicians, because most of it applies just to everyone broadly. So the specific part, well, actually, it's not a specific part, but the part that references internationally trained physicians in the policy says that 1 month after entering the program, you need to have some kind of assessment. It's not a test. People should not be concerned. You will not sit for a board exam. You will not sit for a step. That's not what it is. It's up to the institution to decide what it is. So I can't tell you for sure what it is now, but in general, it's going to be probably someone shadowing you or you shadowing someone else, most likely the former, and just them observing your work a bit. It's not about saying, you're not good enough, we don't want to take you, or you're stupendous and you don't need to be in this program, you're too good. That's not what it's about. Anytime someone is entering clinical practice, the institution that's hiring them just wants to see how you operate, how you work. That happens to all of us. When I started at my last job, I had to shadow people. They saw how I worked. It doesn't matter how many years of experience you have. That's how it works generally in the US and definitely in Massachusetts. So there will be some kind of period mandated by the board where the institution can say, we saw this person in action and we think they should continue and they're appropriate. And I don't want people to worry about that portion. It will not be a problem. And then towards the end of your first year, there'll be a second assessment. Something similar. Again, it will not be a standardized written exam. It will not be that. It's an assessment of practice, not of a knowledge-based exam. So it might be, oh, we watched you 9 months ago. Let's see how you practice now. Let's see how you interact with patients to get a sense and make sure everything still looks good. And that's about what it is. That's most likely what each institution will do. And by that point, anyone in the program will have been in the curriculum, been working with the curriculum, working with colleagues around the state, working with experts in training. So you will have had a lot of support by then. So they're just looking for, again, making sure that people are comfortable in practice and appropriate in practice. So again, I wouldn't worry about either one of these. And at some institutions, the way these kind of evaluations work, you don't even know about it. And I'm not saying that's how it will be for you, but many of us who have been in practice, you get notices saying, oh, you did a fine job with that patient, you met all the goals and criteria, and you should continue with what you're doing. They may not say to you, oh, we're doing a test right now, let's stop everything and have you very awkwardly do something formal. No, you'll just continue what you're doing. So the big takeaway here again is there will be specific elements of the curriculum that the board wants to see that apply to everyone in practice, except they will not be looking for clinical areas, okay? Because the whole goal of this is to bring people in who already have clinical training and clinical capacity. You'll be learning practice-based skills, practice-based elements. And the second part is the board requires that people be assessed at certain points in their licensure. And that will happen, and you should not worry about that portion. All right.
So we have a few questions already
only
in
a
the
few.
chat. Yeah, so far only a few. One person asked if emergency medicine was considered part of primary care, and another person asked if there was availability for people practicing in OB/GYN.
Okay. So we recognize that there are many people in many specialties who could really benefit the whole state by being in practice. This is a new process here, and the state has decided to start with what they consider the greatest need, which is primary care. In Massachusetts, as within the US, primary care includes internal medicine, family medicine, pediatrics, and geriatrics. And the other category here, not in primary care, but to be included, is psychiatry. So unfortunately, no, emergency medicine would not be included in the current iteration of this law. Not to say that it couldn't be in the future, but it would not be included in this program, in this process. Similarly with obstetrics and gynecology. Obstetrics and gynecology occupies to some degree a special space because historically, at some points, it sometimes is considered primary care. I would say the office-based portion of obstetrics and gynecology in some instances has been considered primary care in the past, but it's a surgical specialty. And there are no surgical specialties being included in this iteration of the law. We know that we need OBGYN, but we don't have buy-in from the state to allow people to be licensed. And it's a much more complicated process to get people licensed in surgical specialties in general, including OBGYN. So currently, it is not included, unfortunately.
And we have another question about whether there are criteria for determining what's a shortage area or underserved area. And what I did was, that was in the chat, and I dropped the actual definition from the policy in there. It's defined, they define it as, what do we say? They're looked as an area, the setting has to be an area, a geographic region or population, that's in the law, that is identified either as a health profession shortage area by the Health Resources and Services Administration of the federal government, or another option is a medically underserved area or population as determined by the Health Resources and Services Administration, also the federal government, both in HHS, as of the effective date of this policy. So there's no like list of participating facilities at this point. As Dr. Marlin said, the facilities have to, before the program can be operational at any facility, or before they're eligible to participate, they have to have an assessment and evaluation program in place. And that hasn't happened yet. So we can't know how many there are. And it's, obviously it's optional. We know there's a great deal of interest on the part of, for example, the community health centers as part of the Mass League of Community Health Centers. There's a lot of interest there.
And just to clarify, it's the simple version is it's up to the State Department of Public Health to decide what the shortage areas or shortage populations are. That said, they're going to be all across the state. It's not going to be some little small area. It's going to be in cities. It's going to be in rural areas. It's going to be in all regions of the state. You will find eligible institutions. So most likely, wherever you are, there will be some institution nearby.
Dr. Marlin and Amy, this is Sam. I asked that question, and I guess my follow-up. First of all, thank you for all the work you're doing. This is very monumental, I think, for everyone on the call. But my follow-up question is how, and you may not know the answer, but how will these be marketed? I mean, right now, these jobs that are posted are like primary care physician at this clinic or this hospital. Like, is there going to be explicit language that we can look out for to know, this is exactly what I'm looking for. I qualify for this or I don't. Thanks.
Right. It's a great question, Sam. So it won't be listed, on LinkedIn or Indeed just as physician job. It's going to have a special mention of ITP physician pathway eligibility. What's most likely going to happen, and we can't say for sure, is you'll see a list of potential locations, organizations, both from state websites, from the Mass League of Community Health Centers, from the State Hospital Association. The idea is hopefully they'll all have the same link and the same list saying, here are the institutions that are eligible. What you can say for sure, almost for sure, is that any federally qualified health center is likely to be eligible. So if you know of a health center near you, you can assume it's likely to be eligible. Most what we call safety net hospitals will likely be eligible as well. I can't give you an exact list, but what you can think of is private institutions are generally not eligible. These are not hard and fast rules, because you could have a private hospital in an area of the state that has very few other institutions. And on that basis, the state might say this institution is eligible. So I can't give you a hard and fast rule, but we're hoping, I'm hoping that there'll be over 50 institutions that will be eligible.
Great. Thank you. I appreciate that.
Absolutely.
There were also a couple questions about specific practices. Dermatology, unfortunately, no. General surgery, unfortunately, no. That said, if there were ever the law specifically mentions primary care and psychiatry as the two main shortages that the state is facing. If there should ever be a shortage in general surgeons.
Oh, there is.
Nothing,
I don't want to be saying that we couldn't use more general surgeons. It's just the absolute greatest need and the most immediate need right now is in primary care and psychiatry. This in no way is to diminish the need for general surgery, the need for dermatology. Absolutely. But we have to start someplace, and this is where the state is comfortable starting.
Yeah, and I guess what I would say is the law doesn't prohibit it, but what is required is for the board to determine that there's a physician shortage specialty, and it has not done so, other than primary care and psychiatry. Someone else is asking a great question.
Yes, I would. Good afternoon, everybody, and thank you for all the information you bring to us. My name is Adeski Moise, and fortunately, I'm one of those. I can say they put in the list for the program because I'm a physician and specifically family practitioner. Then um, there's something I didn't catch when you talk about, for example, you talk about the board and the license at the same time, and uh, I would like to know what is the first step to do. For example, for starting the process. For starting the process, if you said for him, for example, we should find any institution who accept us. How I can just make this step to the institution if I do not have the license. I do not have passed the board test at all. Can you please help me to
Yeah, so the
make
first thing,
in order?
yes, it's a good question. So the first thing everyone should do is have your documents in order. So have your diploma from your medical school or advanced training, whatever it is, and it's different in each country. Have, if you already have a file with ECFMG, the Educational Commission for Foreign Medical Graduates, that will be needed. You will have to have passed step 1 and step 2 of the USMLE. So all the usual things you should go ahead and do and be ready to demonstrate them. So,
Okay.
sorry, go ahead.
Yeah, I'm sorry for disturbing you. In my case, I already have all my documentation, and I already sent them to. I forget the name, and I get all those things translated and evaluated from
Great.
Massachusetts.
So you are ready as soon as the list is published of which institutions will be accepting applicants, you're ready to go. And you've already done all the most important work, and I know most of you have. I can't give you an exact date of when this list will come out, but in general, we're hoping that this entire process will be completed over the next year, meaning, and again, it's not exact, but the process of, and these are all things happening at the same time, of us developing the curriculum for the program, of the state putting out the list of which institutions are eligible and which areas are eligible or which populations are eligible, and the process by which people can apply to these institutions and to the state. So now that we have the policies from the state about applying for the license, we are ready to move forward. Everyone who's working on this is ready to move forward so that the process very hopefully could be completed within the next year, meaning we hope that within the next year, people will be able to start or be hired at these institutions to enter into the program.
Okay, thank you. Thank you so much.
Sure.
There are a couple
Other
more
thing,
questions in the chat that I want to
I'm
get
going
to.
to send us
Let's
all
So
the
let's move to
policy.
we want to move to the chat for a second.
Yeah, let's move to the chat. We want to
So-
make sure everyone has a chance to ask questions.
Right.
So the chat is the
All
best
right.
way to do that.
Yes, just put them in there. So Sam also asked, are there laws and policies in place to ensure that ITPs will get fair compensation? In other words, what is stopping hospitals or clinics from exploiting this demographic for lower wages?
It's an excellent question, Sam.
It is.
And I think the fact that MIRA, the MIRA Coalition, is the organization behind the law is one guarantee that we will make sure that people. Can you mute yourself if people are unmuted? Is one guarantee that people will not be abused in the process. So we can't tell you exactly how much people will be paid. I couldn't tell you, but I can tell you that once this program is in place, everyone who's eligible is going to be a very hot commodity. And I hate to put it that way, but you're going to be very desirable applicants for these institutions. And one way that people who are eligible are going to choose where they want to go is salary in part. So I do not expect that people are going to try to lowball salaries for ITPs applying to these jobs. Will you be paid the same as a private practice dermatologist? No, you won't be. But will you be paid a living wage, which is probably above or equal to what someone in residency in the US earns? I would expect that. Again, I don't speak for any institution specifically, but I would expect that very much. So I think based on the desirability that applicants have and the real shortage of physicians, I think people will be paid adequately, and organizations like MIRA and others will be looking out to make sure that's the case.
And I would also add that, remember, this isn't forever. This is a pathway, right? And at the end, you're eligible to apply for a license, a full unrestricted license, unrestricted in any form. So that's important to point out as well. There's also another question here. Yeah, I think you covered this. Someone was asking how you find a clinic who will accept you. Do you look on your own? I think it's a combination, right? We know of many internationally trained physicians who have relationships with community health centers and other health centers, and it's important, if you can, to develop those. If you have those relationships, to use them.
And even before the list comes out, if you want to reach out to them on your own, if you know of a health center where you want to work or a hospital where you'd like to work, reach out to them and tell them, I hope you're going to participate in the Physician Pathway Act program, because I and many other people in the state would be glad to work for you. So let them know.
And then there's a question about, what kind of assessment will be conducted. You said it would be non-clinical. Are we talking about cultural competencies and how to navigate the healthcare system in the US? You want to talk about some of the things that people would need to familiarize themselves with?
I think that's cultural competency is definitely one of them. And that's a broad category. It's going to range from things like that to how do you write a prescription? How you write a prescription in Germany or Thailand is completely different how you do it here. So people are going to have to learn how to do that. How do you use an electronic medical record? That will be a big part of the training. Again, even if you've used one in another country, and not everyone has, it's different here. So those are some of the things. You're going to have to learn everything that someone does to be in practice, except the clinical knowledge. And again, the goal is some people might have been exposed to cultural competency. Some people might not have been. We want to bring everyone in the program up to the same level, so everyone has the same exposure and the same comfort level.
Okay, and then does a medical assistant or patient education work count as recent medical practice?
So I would say the short answer is for the Board of Registration, it does not. However, for institutions looking to hire someone in this program, it doesn't count as medical practice per se, but it certainly counts as really important clinical exposure. And someone who's worked as a medical assistant or a CNA or a nurse, whatever it is, you have an advanced exposure to the healthcare system that's really going to make you a great candidate from that perspective, because you're already quite familiar with it. Not exactly the same way as someone who's a physician, but very much similar. You'll know many of the terms, many of the ideas. So I think it's most important from the institutional perspective if you have that kind of experience, especially at a specific institution. So if you're working as a medical assistant now, that institution knows you well. and can really speak to your strengths and the benefit of bringing you on board as a physician under this program. So I know many of you are in that position. I know many of you have already spoken to your employers, to your teams where you work in these capacities about this. And many of those institutions are very excited about the possibility of bringing you in as a physician. So I think, again, technically for your license, it does not count as medical practice, but it counts for real world exposure, and that's going to be very important in the hiring process at the institution. And I just want to make sure for the person who asked that, does that answer your question?
And feel free to use the raise hand function if you want to speak. And I think Maddie can call on you.
Yeah.
Maddie, are you still with us?
Yes.
There she is.
Yeah, I can't see the questions anymore, but
Right. I did answer one question in the chat about the recency requirement. How long does it take to complete? And I said, in terms of what we're talking about is the reentry program, and that it will likely be incorporated into the mentorship program that you're already in, and will depend on your assessment. In other words, it'll depend on what you need, right?
yeah,
How much
don't think of it as separate.
Yeah. And then I'm looking to see if there's anything else. Oh, one thing I did want to say, people are asking like, when will we know? When will we know if the licenses are available? When will we know when to apply? And I wanted to ask Maddie Crudell if you'd be willing to, if there's a subscription link for anyone who has not applied, who did not find out about this info session through the newsletter. We do have a newsletter, and as soon as we get any update, we will certainly get that information to you. So if you'd like to sign up for the newsletter at that link, Maddie will drop it in the chat. Thank you.
So the best source for information to
Is the
start with
website.
will be African Bridge Network,
Yeah.
Mira Coalition, with specific pages with links about the Physician Pathway Act. And then once you see information there, we'll let people know when it's up on state websites, institutional websites, and then you can go to those individual institutions as well.
So let's take a question from, we have more in the chat, but let's take a question from someone who has their hand up, Junior.
Okay, thank you. And then good evening, everyone. And thank you for this program. I was wondering when you were talking about primary care physician, that being said, should I understand that what we call general medicine for foreign country, can we put that under the umbrella of primary care?
Likely, very likely. It's a little confusing because we used to have something in this country called general practice. It doesn't really exist anymore. But very likely, and I just say, I'm not saying that as 100% because not every country has the same system. Some
Mhm.
countries have general practice as sort of a lower level of care, and
Okay.
then other primary care might be higher than that. But in general, if by general practice you mean providing first line care for people of all ages, then yes. But
Yeah.
yes,
If I can be more clear about it, it's like, let's say I know like in Haiti specifically, you have to complete your internship, which is 1 year after school. And then
right.
after that, you will have to do 1 year for social service.
Yes,
You're gonna work as a physician, but you are not gonna be working to get paid, but it's like a free service that you have to give back what they just gave
yes,
you.
yes,
And then after that, you get your license, right? But if you don't go to a residency program, you will be able to work as a physician, like what we call general medicine.
yes,
So you can be working as an attendant physician in an emergency room. You can be working in a hospital. You just don't have like a specialty, like a certificate, like postgraduate. So
right.
that's what they call general medicine. That's why I'm asking if that goes under the umbrella of like primary care.
And I think, you know, each institution is going to look at it and make their own determination. But there are many countries, Junior, that fall into this category, especially of the social service year. Many countries in Latin America and some in the Caribbean have that system, and others as well. And it's definitely well known in the community and amongst the state that those are many of the people who will be applying. So I can't speak on behalf of the Board of Registration Medicine or the institutions, but they know very well that that's where people are coming from. So yes, it doesn't, you know, you're not going to come in with a document that says primary care, but you will have had much of the experience that is equal to primary care. So again, I would think you should be a good candidate.
Yeah, because I'm gonna finish here, but I have to say, you can be like a general, what they call general physician, and you are working at the hospital. You have the pediatric department. You're on
Right,
call. You
right.
have to respond to emergency OB/GYN. You have to respond to the emergency room. You have to respond to if there's anything on the internal medicine, if you are the only. Sometimes you have like a specific like specialist attending, they are on call. If you have something specific, you just call them.
Mhm.
But you have like a view, a global view.
Yes,
And the first physician is gonna be you. Before the OB/GYN show up, before the surgeon show up, that's gonna be you to call them to let them know there's something here that needs your insight, your input, and then they will show up for that. So this is what they call like general physician.
yes, yes.
Thank you.
That's why we just want to make sure people understand the term doesn't apply in the US the same way, but we know what the experience means for people from most other countries. So yes, you should absolutely apply. And the final decision will be with an institution and the board. But again, people are very familiar with this kind of system.
Thank you.
Sure, thank you. One thing I did want to bring up here before we go to other questions, I'm glad to see we have a lot. We wanted to spend most of our time on questions, is even just applying for such a program is a little bit confusing, as you can tell from what we've had to tell people. And we're hoping that African Bridge Network will be able to, in coordination with other organizations, offer a support program for people who are even just applying to the Physician Pathway Act program. So a program that could help people starting as soon as possible, as soon as it's in place, to start understanding some of the terms we're talking about, to start understanding what is needed to apply. So again, it's not that you would start the program early, but you could get support from an organization to help you through this process, because it's a difficult one. For anyone who's applied to medical school or applied to any kind of training program, you know it's difficult, and especially in another country in another context. So we are looking for support now for African Bridge Network as leading a consortium of institutions to help people be ready to apply for this and to support people in the process. So keep an eye out for that. And that's definitely something where you'll see updates on ABN's webpage when it happens. Sorry, let's go
Okay.
back.
We have a question from Yolanda Coley.
Hello and good afternoon. Two very simple questions that may be linked to one another. One is, Dr. Marlin, you made reference that it could be another year. And so I'm thinking, do you mean not till next year? Will this be implemented, at least getting the list out of these hospitals to apply to? The second part of the question would be, is there a age limit? Will they be putting, an age limit on how old you can be? Because quite frankly, you're aging as you're waiting just to get to be part of this program. Thank you.
Sure. Good questions. Thank you. So the first one first, I said my expectation, again, I can't be exact about it, is that the program would be able to launch in a year, meaning someone would be able to start in one of these positions. So well in advance of that, we should have a list of organizations, of institutions that would be looking to hire people and that would be eligible to participate themselves in the state program. So I'm thinking more like a year from now, let's say July, because July is when the new year starts for the state. Let's say July might be when people are actually starting in these positions. Again, I can't promise it absolutely, but that's what I think many of us will be pushing for now that we have some momentum, now that we have policies from the state. And again, all of you urging the institutions where you're interested to work and the state itself urge the state to keep moving on this, and that's how we'll get there faster. In terms of age, what you're describing, Yolanda, is clear discrimination. So it would not be allowed, and there is no age cutoff that I'm aware of or that I know of for any licensure in the state. Now, if someone were 93 and applying, an institution could ask them, say, well, we're not sure you're cognitively intact. Would you be willing to take a cognitive exam? But I don't expect that to happen to any, if not the vast majority of candidates. And again, if it's as you describe, it's just age discrimination, which would be illegal. I'll defer to Amy as the attorney, but yeah, it's just not allowed.
I would agree with that. I think, yeah, I don't know how the board would deal with it. There's another really great question here, and then I will get to you, Dr. Goncha Elchin. Am I saying your name right? I'm not sure. Yes. Amazing. Okay. Someone asked a great question, which is, Dr. Willis, is the licentiate of the Medical Council of Canada accepted in place of ECFMG certification? And I can say that the law itself allows another organization besides ECFMG, but the policies do not seem to reflect that.
And this is the kind of thing that we hope to
This is a good
learn from
question.
you all.
Yep.
And that's something that we'll bring back to the Board of Registration in Medicine to make sure they're aware of and they include in their policies. But I think as Amy is intimating, we don't know, but it should be.
Yeah. Okay. And then we have Concha Elchin.
My question is also about ECFMG and the USMLE Step 3. So in Massachusetts, there is the 7-year rule. So you have to take all steps in 7 years. But there might be some other people like me. I have the ECFMG certification from 20 years earlier, and I just passed USMLE Step 3 last year, so it's not in 7 years. So my question is the 7-year rule will be for PPA, will be the rule for PPA.
And you're talking about when you say you saw it as the current rule, you saw it on the Board of Registration in Medicine's policies, or you saw it for residency programs?
For residency in Massachusetts, it's the 7-year rule is applied here.
So you say, so again, where did you see it?
I think I saw it in the residency programs in Massachusetts.
Right. So if something applies specifically to residency programs, it will not apply in this case. And we're not aware of anything that the board has put forward to say that there is such a 7-year rule. And I'm familiar with what you're talking about for residency programs. But again, this is not a residency program. Now, an institution could look at your documents and say, you know, you have whatever number of years between step 2 and step 3. explain to us why that still works for practice, why that still works to get into this program. So that I would expect would be more of a discussion with the institution who might be hiring you, but not so much for the license. It might be an issue of recency, though, Dr. Elton. So if you have not practiced in, I'm just going to put a large number out there, 14 years or 20 years, there might be hesitancy on the part of an institution to take you on. I'll just be honest. But in terms of specifically a 7-year rule between the steps of USMLE, not as far as the Board of Residency policies are in place currently that I've seen, but we will bring it back to them as a point.
Okay, so a clear sentence about this would be so wonderful, like whether
Yes.
it is the rule or not. Thank you so much.
Again, this is exactly the information we wanted to get from you because you all are the experts on this process, believe it or not. So we will bring that point back to the board and get clarification as well.
And we are keeping all the questions in the chat for that purpose as well. And I would say another question here, and then I will get to you, Sam, again, is the full-time requirement absolute, or would a job offer of part-time but over a longer period of time be acceptable? The answer is it's required because it's in the statute. So the board can't do anything different than what was in the law that was passed.
Right.
And now go ahead, Sam.
Yeah, thanks again. So I'm going back and forth with residency or pursuing this pathway. Now, my understanding is the residency is approximately 3 years, and the pathway for full licensure in Massachusetts is approximately 3 years. So the duration is the same. It sounds like the salary is comparable in those durations. I understand a residency is hopefully more grueling than the licensure. Through residency, I have the opportunity to be board certified, which it seems like I do not with the PPA. Becoming board certified, obviously, I can practice anywhere in America. My earning power is significantly higher, I imagine. So this is kind of where I'm a little skeptical in some aspects of this. I don't know if you all have thought about that or can touch more on that.
So I think first of all, let me say, if you're in a position to decide between residency and this, you're in a great position, right? We know that many people, may not have been able to get a residency spot. It's very hard. And the point of the law is to make use of your great skills without putting people through the process of another 3 to 5 to 6 years of training. My recommendation to most people is if you have the opportunity to apply to a residency and you want to do that, don't think of it as a separate process. You might want to do it in parallel with this. You might want to pursue both at the same time because it's really all the same requirements. There's not much that's different. On the point of board certification, Sam, just to be clear, there is nothing in place currently, but there is a desire on many people's part and some willingness at least to listen to it from some boards about having people who complete this type of program be eligible to sit for the boards. And if any of you are not familiar with what Sam is talking about, I suggest reading a little bit, but and I know the terms are confusing because I've been saying the Board of Medicine, the Board of Licensure in the state. That's different than the specialty board that Sam is referring to. The specialty board is a non-governmental organization that in essence controls and decides who can say they are an internal medicine specialist or a neurologist or any of these things by taking a test. And for the most part, you're only allowed to take the test if you've completed a residency generally in the US. Could be someplace else, but that's a little complicated, but generally in the US. So as of right now, there's no mechanism for people who complete this program in Massachusetts or any other similar program anywhere else to become board certified. And as Sam said, most jobs in the US today, and I want to emphasize today, ask that you be board certified or board eligible in this specialty. We think, excuse me, as we said, that there hopefully may be some opportunities for people to get board certified by participating in this and other similar programs. I can't guarantee that. So again, coming back to your original question, Sam, if you have the opportunity and desire to apply to a residency program and have an anticipation that you might get in, I would say do it. Does that mean that you can't also look to this kind of program? No, you can do them both at the same time. I wouldn't want to see people pursue one and say, I'll wait and see what happens, and then wait, 2 or 3 cycles later to participate in this. So I wouldn't think of them as they are distinct, but they're not mutually exclusive, meaning you can apply to both of them at the same time.
And I would add just, the whole purpose of developing this legislation in the first place was because a U.S. residency is difficult for people who graduated. The longer period of time since they graduated, the harder it is, which has this perverse result that sometimes the more experienced a physician is, the less likely they are to get a residency because they graduated a longer period of time ago. And so that's been what we've been told by the physicians that we've been working with. I'm seeing some nods.
Great, thank you. I appreciate the help on that.
And then there's another great question here. What happens if I started the process in New York State? Should I start another one from Massachusetts? I'm not sure what you mean. This is from Valerie St. Dime Thomas. I'm not sure what you mean by the process.
26. Yes.
Maybe Valerie, if you're still here, you could explain what you mean by the process that you started in New York. Okay.
If she's not
Should we try to
responding,
guess?
yeah, I was going to guess applying for a license. I don't recall what the status of any kind of similar law is in New York State. I don't know if you do, Amy, but I would say the short answer is if you've got all these documents ready, if you've got your ECFMG profile ready to go because you're applying there, then you probably have most of what you need to apply here. That said, we're not that familiar with what is happening in New York, but we're assuming you're talking about a license application for someone who is not looking to pursue a residency. So I would say if you're doing it in New York, it doesn't mean you can't pursue it here at the same time, but they're going to be slightly different programs. Keep that in mind.
Okay. And then someone else is asking, after 3 years, if you're successful, when you finish the program, the pathway, and you are eligible to apply, you can practice anywhere in Massachusetts in family medicine as a PCP or in psych? ? The
Yes,
answer is
that's
yes.
correct. That's correct. And, to Sam's point, we recognize that if you're in this program, well, at least if you're in the first year of this program, guaranteed, you're probably going to make less than someone who would be in practice who wasn't in the program. Because as you can understand, if the institution is supporting you and if you're getting this kind of support and this curriculum, it takes away from being able to see patients. And it's important. So you wouldn't be paid exactly the same, but I want to emphasize you could be in this program for 6 years by choice between you and the institution. So if you did 1 year of the program, the first part of the license, you and the institution could say, I'm doing well, but I think I could learn more before I'm comfortable really going out without this kind of support. I want to do another year of this. Again, full scope practice, but with supports in place. Okay. Again, non-clinical supports. Then once you're done with that, the second part of the license, I can't tell you exactly how folks will be paid, but you're not going to be in the same kind of we anticipate that in the second part of the license, the curriculum will be not quite as structured and not quite as won't take up as much time because you're going to be more advanced. So again, on that basis, again, just my own presumption, you would be paid more. So it may not be in everyone's interest to finish the program as quickly as they can. You might want to stay in the program 4 years, 5 years, who knows, just because of the supports in place. I don't know if that answered your question, but to your specific question, yes, after 3 years, if you successfully complete the program, you would be eligible to apply for a full license where you could practice anywhere you wanted in the state, in Massachusetts.
And someone asked if, is there any way, if you have a background as a specialist in public health, I assume currently, are there any shortcuts to begin practicing sooner? And my answer is you can begin practicing as soon as you get the license. You just would be licensing at the, you wouldn't be able to jump the pathway. You'd still have to have the 1 year limited license and the 2 year restricted license before you'd be eligible for a full license.
But with a background in public health, you would probably have a lot of knowledge in some of the areas we talked about before. So again, I would encourage people, rather than looking to jump ahead and skip certain parts, is just take your strengths and work those strengths in the program to get really comfortable and be well supported and then move on. But as Amy said, no, it would not allow you to skip ahead.
And then there's an interesting question. Which position within medical centers or facilities are the most appropriate points of contact to outreach to for this?
I would say in general, the easiest to contact and probably the most appropriate are human resources departments. They're the ones who are going to be easiest to find online on their own websites. They will probably have email addresses or pages where you can send a message or leave a question. I would encourage you to do that, to use that as a mechanism. And if you can't, if you don't get information back from a specific institution, so if it's a community health center, I would say contact the Massachusetts League of Community Health Centers and say, I'm trying to contact, this community health center, this specific one in this town. Can you help me? I'm looking to find out if they're going to be taking people under the PPA program. And they'd be glad to facilitate that communication. If you're looking for a hospital, it might be the Massachusetts Health and Hospital Association. Again, similarly, I tried to contact this hospital in this area and didn't hear back. Could you help me be in communication with them? And again, I think they would be glad to do it. You have to remember that just as, well, actually, I think you're all more advanced in knowledge of the PPA program than some hospitals and institutions will be at this point. So it could be, you might ask a specific institution and they might say, we're not familiar with this program. Again, if that's the case, I would go back to the association. So the Massachusetts League of Community Health Centers represents all community health centers in the state as a group, and the Massachusetts Health and Hospital Association represents all hospitals. So if you find an institution that is not familiar with the PPA, don't give up and don't accept their response as the final word. They may be interested in learning more. You can go back to their association and let them know and the association can teach them about the program, and then hopefully help you connect with them as well.
I see another question from someone who is an owner of a private primary care and pain management center in Boston and wants to be a provider and sponsor, and they want to know how they can apply. And I would say that you cannot, because the law restricts participation by healthcare facilities to the named. You'll see it in the slideshow. You might have missed the beginning, to the facilities that are named in the law. That is to say, federally qualified health centers, community mental health centers, and hospitals approved by the board.
But we very much appreciate the interest. And
Yeah.
it doesn't mean that in some future iteration it might not be possible. But right now, what you're describing sounds like a private practice. And for now, private practices are not in a position to sponsor these. But again, it's a new program that might change in the future, and it's going to depend on what your practice looks like. If you're a practice of 50 and you're very robust and you have experience with learners, that's fine. If you're a one-person practice, I don't think you're in a good position to take one of these folks on. That's my impression right now. Again, things could change, but we appreciate the interest.
All right. We have some repeat questions, of course. I'm just looking to see if there's anything new. Okay, people asking about someone's a pediatrician, wants to know if she can qualify. Pediatrics is not included, right?
Pediatrics is absolutely
It is
included. Let's be
included. Okay.
clear.
See, I'm not the
Pediatrics-
doctor. He's the doctor.
Pediatrics is primary care, so it's
Okay.
definitely included.
Okay, there you go. Yeah, other questions here. I think,
I see one.
yeah, go ahead.
I see one from Emmanuel. Are tropical diseases and HIV/AIDS management considered high interest? I would say yes, in the context of primary care. So there's very few people, I would say 0 people, whose practice is just tropical diseases in Massachusetts. It's just not enough of a request. But tropical diseases, that's not usually the term we use, but those kinds of illnesses certainly come up in primary care. HIV management is certainly an area that many people in primary care practice. So yes, if both of those are in the context of primary care, then yes, they would definitely be things that would be included in that area of practice.
Thank you for that correction, Dr. Marlin. And someone else asks, they are an MD from Russia with a radiology specialization, but his, oh no, well, Emmanuel, you put this in here. It says, my MD was recognized as general medicine in Spain, where I also completed a master's in general medicine.
So again, I can't give you a definite answer, but I think we'd be looking to your Spanish credentials in addition to your credentials from Russia, because if you were practicing in primary care in Spain, that's what counts. Many people go to school in one country, train in another country, practice in another country beyond that. So I would say that's fine in terms of applying to this program. As long as you have the experience someplace, that's great. So I can't speak to a specific case because we can't review it here, but that sounds like someone who should absolutely apply and get reviewed.
So someone else asked, Hadassah Charles asked, are ITPs offered support for USMLE Step 1 and Step 2? That's something we wish we could do. I am assuming you mean financial support, right? And not yet. It's a future project. someone else asked if someone who's had 7 years of medical school in their home country and 1 year of an internship, could that be considered a year of practice?
Say it again.
They're wondering if after medical school, 1 year, 7 years of medical school and 1 year of an internship, whether the internship could be considered a year of practice.
Again, we recognize, and the state recognizes, that the terminology is very different in each country. So the fact that you were in practice after your training is a case that should definitely be reviewed, meaning you should speak to an institution that you're interested in, but it's going to take a little bit more of a formal review to decide. I can't tell you definitely you meet the criteria. Based on your description, I think you probably would, but I can't say for sure. The fact that you call it an internship, did you have a license? Again, we recognize that these processes are very different in each country. So I think it's always good to err on the side of talking to more people, meaning talk to institutions you're interested in. We will try to have these kinds of answers from the board of registration, like when we come up on the website. But most likely, you're going to have your individual case reviewed to get an answer, because again, it doesn't map cleanly to the U.S. system. So people need to think about it a little bit.
One thing I would say is the law does require for the person to be eligible, to be authorized to practice, to be either licensed to practice medicine or otherwise authorized by whatever the body is that authorizes medical practice for that 1 year. So that's important.
Right.
All right. Someone else is asking, do we need any documents to prove that we worked as a general physician in our country? Yes.
The more documents, the better.
Yeah.
So if you have something, definitely include it in your application. You definitely will need to show that you were licensed or authorized to practice. If you have something additional that shows you did practice, that's even better. But it wouldn't be sufficient. It's not enough just to show that you practiced. Ideally, you would have something that shows you had permission to practice from whatever governmental, non-governmental organization has the power to decide that in that country.
And there's a question from YouTube. Thank you, Maddie, for dropping these in. What about ITPs who did a residency abroad but are currently enrolled in ACGME accredited fellowships? Does that give any advantages? Like, it wouldn't make you eligible.
You would probably, let me just see, read the first part again.
An ITP they're asking about ITPs who did their residency abroad. In other words, they have their clinical training and they're currently enrolled in an ACGME accredited fellowship.
So 2 things. If you were never licensed or authorized to practice, and our assumption is if you were in residency, then you were practicing under someone else's license. So if you were not eligible or licensed or authorized to practice, then you wouldn't meet the criteria of this program. So you wouldn't be able to. But my second question is, if you're in an ACGME fellowship, why would you want to do this? I'm not sure, because you're already on track to finish a fellowship, which, again, I can't speak to it specifically, but in many cases, if you finish a fellowship in the US, it will often get you the ability to apply for a license in many states. So again, I can't give any specifics, recommendations around that, but I'm a little confused why someone would want to drop out of a fellowship to do this. But if there's more to the question, definitely reach out. We'd love to understand more. And it's the kind of question that we will also bring back to the board. Or you could even bring to the board if you wanted to. There is a mechanism on the link that we included with the board's policies that you can contact them directly. But that one, we'd like to hear a little bit more about. But again, just to recap, if you were never licensed or authorized to practice, you would not technically meet the criteria for this program.
And then another question also from YouTube. After obtaining the full license, will we be able to practice in any hospital in Massachusetts, or is this only in hospitals providing primary care? The answer is you can practice anywhere and in any practice area that you're qualified to practice in. Right?
Yes. So hospitals or other institutions aren't specific to one area of practice. So there's no hospital that only provides primary care services. There's no community health center that I'm aware of that only provides primary care services and nothing else. So it's, as Amy said, once you've completed the program, you would be eligible to work any place. It doesn't mean someplace has to hire you. No one's obligated to hire you, but you'd be eligible to work, not in any specialty. So just to be clear, the way licensure works in Massachusetts is I'm not licensed as an internist. I cannot be licensed as a surgeon. From the state's perspective, you're just licensed as a physician. It's a general license. But if your training is in primary care or your experience is in primary care, I would not expect that some hospital is going to hire you as a surgeon or as a neurologist. So again, my expectation is if you work in primary care or if you work in psychiatry through this program, you should expect to probably work in one of those areas. Now, just to be fair, once you have the full license, you can do whatever you want, and an institution can hire you if they want to, right? Doesn't matter what the specialty is. You have the license. I just wouldn't
be a
want you
private
to expect
practice
it.
too, right, Ron?
Sorry? Private practice.
Private
You can
practice
practice
can hire
anywhere
them
you want.
too. Yeah,
Yeah.
you're not
You can,
required to.
we call it putting out a shingle. You can put out a shingle and practice, absolutely.
Then there's a question about advocating for foreign graduates and specialties outside the ones eligible for the Physician Pathway Act, wondering if ABE advocates for these folks, also for these professionals. And Jean-Pierre is saying so because some specialists are very much capable and comfortable to work as primary care physicians. So there's kind of two questions there. One of them,
Yeah.
are we advocating for physicians who have other specialties? And then the other question is, I think the implicit question is, if you're a dermatologist, can you work as a primary care physician?
So
even if you're comfortable.
I think right now we are not advocating for specialists, not because we don't think it's something that's needed, but because, as you can see from the timeline, it takes quite a bit of work just to get this program focused on primary care and psychiatry off the ground and hopefully successful. So it is not something we're working on currently. I would say if this program is successful, that may happen. And we could all, and you could be the one to push for it. Doesn't have to be us. And the second part is it gets into the issue of specialization. So in some countries, primary care is sort of seen as the lowest level of practice. Again, this is not my view necessarily, but sort of the way Junior was talking before about general practice. I know in some areas of Russia and the former Soviet Union, for instance, I've had some colleagues who say, well, I trained as a physician, so I could certainly work as a nurse here in the US. It doesn't work that way. So if you trained as a dermatologist or worked as a dermatologist or worked as a neurosurgeon, you would not be considered eligible to work in primary care because it's considered a specialty. It's not, and that's where I think it may be, it can help to understand that it's different than general practice. So in many places, people will work in general practice for a while and then go on to a specialty training. And that's not what we're talking about here. So primary care, you have to think of as a specialty itself: internal medicine, family medicine, pediatrics, geriatrics certainly is a specialty here, and psychiatry is a specialty. So the short answer is no. Based on your description, you would not be able to practice in primary care if you did not train in that area. But again, I would encourage anyone to have an institution, when we have the list of those who are looking to hire, have them look at it and see what they think.
Okay, someone is asking, Karen DeMello is asking, what is the requirement for the number of physicians in a practice to participate in the PPA? Not sure what that means. There's no numerical cap on the number of
No.
ITPs.
There's no
that
minimum or
participate.
maximum.
Exactly. And then also, if an institution is willing to participate, what would the next steps be? And again, as we mentioned earlier, that institution has to apply to be eligible as a participating facility. And for that, they need to develop the assessment and evaluation program that we talked about earlier. I have the impression here too that some of these questions are from people who've missed parts of the presentation. So I want to encourage anyone who's not getting their questions answered to take heart, because we are going to be sharing the presentation with people afterward, both the recorded presentation and the slideshow with the information.
Right.
Okay. Oh, here's a great question. You ready for this, Dr. Marlin?
Sure.
Dr. Shaheen Rouhani is asking, are insurance companies eager to work with us?
So I don't want to speak on the behalf of insurance companies, but the short answer is yes, because we think of institutions as not having enough physicians right now. Insurance companies also don't have enough. So these days, many insurance companies have very close relationships with the institutions they work with, and are looking to get more physicians on what we call their panels, physicians who are working as part of their programs at an institution, but eligible to bill their insurance company. So I would say yes, insurance companies in general are eager to see more physicians, including through this program. Just like hospitals and healthcare centers are getting calls every day from people saying, why am I waiting 9 months to see a primary care physician or 9 months to see a psychiatrist? I'm frustrated. Do something about it. Insurance companies are also getting those calls. So they definitely have an interest in seeing this program succeed and in seeing people get licensed under this program. A long way to say, yes, everyone's interested.
Okay. Honestly, I think a lot of people are asking, again, questions that we covered it already. I'm looking to see if there's anything else here. Anything that you're seeing, Maddie, that you think that we haven't answered?
I'm gonna check the YouTube chat here. I think most of the
Yeah.
thought I have already put in the Zoom
Oh,
chat.
I see one while you're looking that I really want to respond to. I'm going to read it first, and then I'm going to respond because I think it's really important. And this is from BT. So, and I'm quoting, so it is basically a cultural fitness evaluation. Do you think some immigrant demographics, Western countries, might have a leg up compared to others? And I'm going to say absolutely no. I think everyone is eligible for this. And BT, I understand where your question is coming from, but I actually think in many ways it's the reverse. Because while some people who trained in Western countries might have some more familiarity with some of the technical issues like computer systems and other things, some people who are not from those countries will have a better understanding of the experience of the patients we're trying to serve. So, I think I can speak for Amy here and for Amira. When we were working on this, we recognized that many of the people who are underserved in Massachusetts, not all, but many, are people who speak another primary language other than English, including when they go to a doctor's visit or when they're at home, or are people of color. So they are often looking for someone who has something of a shared experience, right? So someone who is not from, you said a Western country, I'm not sure exactly what you meant, but let's say not from Europe, might have a better understanding of a patient who's also not from Europe. Not necessarily the same country even, just have the experience of being an immigrant here. So I would say absolutely, I do not think it is a cultural fitness test in the way you were saying, BT. And I would not say that people from Western countries have a leg up. I do not think so, and is my firm desire not to see the program play out that way, and I don't expect it either. Any others?
So I see something here that Maddie posted from I guess from the YouTube channel. Oh, I see. It says if community health center staff are on the call, please email the Mass League, where we are starting a committee to help inform the processes to implement the PPA. And also adds, Dr. Marlin, feel free to share my info with individuals. I'm not sure who posted that though. Do you know?
Yeah, I asked for her to email me in the YouTube chat, so hopefully I'll get the contact.
Fantastic. Fantastic. That's great. So someone from the league is on the call. Yay. Great partners. We could not have gotten this law passed without the Mass League. Also, there's a question, what if a certified family nurse practitioner in the US or certified PA in Puerto Rico, will that be considered as meeting the requirements?
Again, it's an excellent question that we will bring back to the board. Very technically, I would say, no, you have not been in practice as a physician, but you've been in practice. And we will bring it to the board to ask them. But I would say from the perspective of the institutions, especially, you're going to be a very desirable candidate. And I personally know a number of people who have retrained as NPs or PAs because it's a relatively, not easy, but relatively short process compared to becoming a physician. People who have retrained when they came to the US as an NP or a PA and then been working. Certainly, you have all kinds of experience and are engaging in exactly the practice issues that people will be focusing on in this program. So I would say you would be an incredibly, incredibly desirable candidate for this. I can't speak, and let me go back to something I said earlier. So I think your question gets at, could we be considered to have been in practice for the past 2 years, within the past 2 years, and therefore meet the recency requirement? Whether you do or not, in a way, I would say I would put that aside, because what you do is you have great experience And as I said, whether you meet the recency requirement or not, or even if you do, you're going to need to participate in this process in the curriculum. So it doesn't really matter in those cases if you've been working until today as a PA or an NP. It's not going to it might get you out of the recency requirement. It's not going to get you out of participating in the program. But I would anticipate, not having looked at any particular case, that people in that category would do the 1 year, only 1 year of the first part of the license, only 2 years of the second part of the license, and relatively speaking, sail through. You're going to do very well and be extremely desirable as candidates, as employees.
And just to clarify, that 1 year is the required amount for the first step, the limited license. You can repeat it. It can be 2 years. And Dr.
Yes.
Marlin is saying
Yes.
you'd probably complete it in 1 year. But the person would still have to pass the USMLEs, step 1 and step 2.
All the same requirements.
Have
All the same
to, get
requirements.
there right, all that stuff.
In many cases, again, I'm not looking at your specific case who's ever asking the question, but in cases I'm familiar with, many people who have gone the NP or PA route have already passed their exams. So
they don't have to have been, but they have to have been authorized to practice as a physician
they still do. So
under the law
I'll give an example.
for their year of practice.
Yeah, someone in the Czech Republic or someone in India completed all their training and might have worked for 2 to 5 years and then came here and said, either I can't apply and be accepted in a residency or I don't want to, and opted instead to do NP or PA training and got licensed through those programs. That person would be perfectly eligible to participate in this program. And
Great.
To be honest, I understand why. You want to get back to being a physician and being licensed as a physician. So yes, again, excellent candidates you would be for this program.
And we have a question from Sha Quinn, who is here with us. I hope I didn't mispronounce your name. I probably did. Feel free to ask your question. Oh, but I think
Hi, yes. So
there
I
you
put
go.
my question
Okay,
in
thought
the
we
chat
lost you.
before.
Okay.
Yeah, so I just wanted to ask if we could have more information about the ABN support program for ITPs considering this whole process right now. Like, aside from just learning about these policies and the terminologies and how it all work, will there be other support program components? So I listed some possible ones in the chat, like peer mentorship, job board, or peers sharing information in the group chat, English support, USMLE support, or something similar.
I think you just wrote the program for the ABN team who's listening. You need to pay attention to what Shaquin wrote because that's perfect. So it doesn't exist yet, to be honest, but it's being built based on your input, everyone's input. We're hoping to be able to launch something that will do this. And again, I know a lot of times it feels like you're waiting for everyone else to provide you information, but the information you just provided, everything you listed, that's a great jumping off point for such a program. Again, we're working on getting it funded. We're working on getting it built. So it doesn't exist yet, but we would hope that it would be the fastest part of this process, meaning it would be developed as soon as possible so that it could help support people who are applying to the PPA program.
Thank you.
Thanks so much for the question. That's great. I just want to, before we take any other questions, I want to just read something that Pierre-Louis wrote because I love the statement. Cultural competency is keen as a tool that all doctors need to have as a tool to better understand patients. I just can't tell you, I can't find my emojis to put up a heart, Pierre, but this is exactly right. And I don't want people to think of cultural competency that's something to be used with certain patients by certain physicians. It's something that all physicians need to learn to work with all patients. So I just love that statement. And I don't use that word very, very often, but I really love it. It's wonderful.
Okay, someone else is asking about whether they need work authorization.
So, the short answer is, and I'll defer to Amy as a former immigration attorney on this, is you need to be eligible to work in the state in order to participate in the program, meaning you need to be eligible to work to get hired. That's
In the
just a given.
country,
Well, yes, in the country, but we're only talking about Massachusetts. So for the program, you need to be eligible to work. I think that's the short answer.
Okay. Yeah, the legislation was really designed for people who are here. Hasn't been designed for people seeking visas to come to the US. Someone asked, is there a particular person or department at the Mass League that is responsible for working with health centers on this? In other words, who's the best person to contact?
There's a team, and we're going to let our colleagues from the Mass League who are on, Maddie, I think you can see them in the YouTube feed. And hopefully they're going to put up, if we don't get it during the course of this conversation, we'll make sure that it's up on the Mira website and the ABN website about who to contact there. And we'll try to get the same one for Mass Health and Hospital Association. But yes, there will be someone specific or a team that's specific.
And Sam, it has another question.
I got you guys in front of me, so I got to send it. And excuse my recall ability if I don't state them correctly, but the 1-year limited license and the 2-year unrestricted or restricted license is the intent for those to be completed in the same facility?
It's a great question. They certainly can be, and from my perspective, I would encourage both the internationally trained physician and the institutions to try for that. But there's no requirement that they be completed in the same facility. Not that I'm aware of. Correct, Amy?
Say that again. I'm sorry. I was just looking at that again.
There's no requirement that the period of limited licensure and the period of restricted licensure be completed in the same institution.
No, absolutely not. You can work in any facility. You're just restricted by the shortage specialty and shortage area requirement.
Yeah, I guess the concern was like, after 1 year, do you have to like look for another job? And
No.
Okay.
No, you can stay. We anticipate most people probably would stay because they're already practicing there.
Got it.
And from the institutional perspective, I would posit that they're going to want you to stay. They're not required to keep you, I have to say, but they're going to want you to stay because they've made a pretty substantial investment in you, and they want to see you work there.
And is nephrology, does that qualify?
No, that is not primary care. So if you've only trained in nephrology, I think it's going to be pretty tough right now. Again, not to say we really need nephrologists for so many reasons I won't get into now more and more, but under this program, you wouldn't qualify.
Okay, thank you.
Did you train in nephrology, Sam?
I'm actually asking on behalf of my fiance. She's sleeping right now because of the time zone, but I framed everything like myself. She's a nephrologist, but she has spent about 8 months in primary care currently. And I don't know if there is a minimum requirement in primary care.
It's 1 year.
1 year, right? Okay.
Yeah.
Got it.
So if the clock is still going, she'll get there in 4 months.
Got it. Thank you.
Sure.
So we have another interesting question that I think technically this person would be eligible, but I'm not sure how it would work in practice. So we have someone here. Musarat says 7 years experience as a primary care physician definitely makes you eligible, right? Then 10 years as a radiologist. So there's recency of practice, right? But not in primary care. 10 years since the person practiced in primary care.
I think in terms of the Board of Registration in Medicine's policies, you meet the criteria.
Right.
That's what I would say. You may have a harder time with an institution interested in hiring you. I'm not saying you will, but they might say you haven't been working in this area, so we're not as interested. At the same time, they might say, you know this area, you're qualified, and you've been practicing recently. So it could be either way. Again, it's another one of those cases where I would absolutely bring it to an institution to look at. What was the specialty in?
Radiology.
Radiology. Yeah, I would definitely encourage you to bring it to an institution to look at, to review. But that's the kind of perfect question. So you meet the letter of the law, meaning you meet all the requirements. So you could get a license, but we can't force or guarantee that an institution will want to hire you out of 10 years of radiology practice. I mean, I would if I was, hiring, because you've got great insights and primary care. But we can't speak for any specific institution. So bring it to an institution once we have a list, bring it to someplace local, and have them review it. I just wanted to clarify, if you can, are you practicing as a radiologist in the US now or not? I wasn't clear about that.
I am now practicing as a ultrasound tech.
Okay.
Mm.
Okay.
Thank you for answering. Thank you.
Oh yeah, thank you for the question.
All right. Someone asked about the curriculum, whether it's been structured already. The answer is no. That's the big hurdle right now. That's why it's going to take another year. Someone has
There's a
asked
question on residency in Massachusetts. Can you speak to that?
on residency.
Let's
Could
see.
you ask the question? Read it to us.
I see it. I can.
Okay.
Do you have to be a resident of Massachusetts to participate? I live in Connecticut, but very close to Massachusetts. Absolutely not. So there is no restriction. If you're eligible to be hired in Massachusetts, you can participate. And we know many physicians and clinicians live in nearby states and might come down to Massachusetts or come up to Massachusetts. So absolutely, you would be eligible on that basis. There's no residency required in Massachusetts. You have to be physically present. So it would be hard if you're in Idaho or Florida to be in this program. But Connecticut, Rhode Island, Vermont, New Hampshire, I would throw Maine in there too, in New York State. You should be able to do, because plenty of people work from those places. So absolutely apply from Connecticut.
Someone else asked if noted that obviously psychiatry is not part of primary care. Are the requirements the same if someone is a physician with a specialization in psychiatry? Absolutely yes. That is one of the other shortage specialties. The two are the primary care specialties or areas within, similar to primary care in the US. All of those many areas that you mentioned earlier, Rob, that I never get straight. And also psychiatry. That's the other one.
Not
So,
also,
absolutely.
and.
Well, I meant in addition to.
I know.
Not at the same time.
I know. I just want to emphasize how important psychiatry is.
Very important. That's a big shortage. That is a really important shortage area. Mental health is a big problem. And there's not a lot of providers. Someone's asking about support for servicemen, nothing like that. Someone looked up, let me just see here. Okay, someone else is talking about specialty board certification. She says, this is Rue, I've just looked up the difference that board certification makes to the ability to practice after an unrestricted license has been granted. So Rue is thinking about post-licensure barriers. It seems it makes a huge difference. The fact that you can't take the board specialty board certification exams after completing the pathway is a very big gap.
So I just want to be clear, it's not a restriction on licensure. So you don't have to pass specialty board. No, she said licensure. So or working.
No, the ability to practice after receiving the license, the final unrestricted license to practice, her concern is about the specialty board certification
It's an
after
important,
completing the pathway.
yeah, I think if you're just talking in general, yes. As of today, it is an issue. But again, we want to parse out these different areas. In terms of a license, it is not an issue whatsoever. In terms of getting hired and in terms of an insurance company paying for your work, today, yes, you are correct. It is likely or possibly an issue. Part of the goal, once this program is put in place and is active, is not that we just sit back and say, oh, great, we did it, now we're done, but it's to work on issues just like that, that we can try to make sure that by the time someone is done with the program, we've brought insurance companies on board to agree that maybe you no longer have to either be board certified to work. I can't guarantee any of this. Or again, we're going to try to work with the board, the specialty boards themselves, to allow people to be eligible to sit for the exams. And again, that's not a promise, that's a hope on my part and our part, but it's also something all of you can advocate for. So for people who enter into the program, I very much hope and expect you to be advocates for the program when you're in it, so that you can reach out, not on your own, but with others, to the specialty board and say, I'm in this program in Massachusetts. How can I help you make sure that there'll be more board certified physicians by allowing me to sit for the exam? Or to the insurance company, how can I help you produce more physicians in the state by saying you'll accept my work, even if I'm not yet board certified? So as of today, Rue, yes, it's true. I would say your employment might be more limited in some ways, but by the time the program's done, we hope that your advocacy would have helped us change that.
Okay, and I think this is the last question. It's 7 o'clock. Someone asked if there's a time limit for step 3 when completing the PPA pathway. And I would say, and you tell me if I'm wrong, that step 3 has to be completed before you're eligible for the restricted license, right? So most people will have completed it during their mentorship program, during that 1 or 2 years of initial licensure. And then they'll complete it during that period, and then they'll be eligible for the second phase, which is a restricted license, again, restricted as restricted to the shortage areas, practice areas, and specialties. Sorry, shortage geographical areas and practice areas.
Yes, that's right. Yes.
Yeah. And I think we're done. I, personally, just on behalf of Mira, I just want to thank everyone for staying with us for almost 2 hours. And we hope we answered most of your questions, and you will get a copy of this recording as well as a copy of the slideshow we presented. And Dr. Marlin, what would you like to say?
Well, I'd like to say, as with every time that we interact with the internationally trained physician community, we learn things. I learned things today that I didn't know. And that's how this whole process started. So I want all of you to keep in mind, this process started because internationally trained physicians said, how can we change things? It didn't come from me. It didn't come from Amy. It didn't come from ABN. It came from you all. It came from the community. So we need your continued engagement. This was wonderful. We're going to try to post specific answers to some of the specific questions that we didn't have answers to at the time. We'll post them hopefully both at Mira and at ABN. We're going to get you that contact information for the Mass League, as well as for Mass Health and Hospitals. And please continue to stay engaged. And we apologize for what seemed like a long period of silence. It was not a period of inactivity. So just know, if you haven't heard an update in a week, it's not because nothing's happening. And if you have a question, send it in to Mira, to ABN, to the Mass League, whoever it is, because your questions are what propel this process forward.
I'm going to put our information in the chat. Our email.
And do we have a general Mira address for the PPA?
No, we don't,
I
unfortunately.
think we should come up with one.
Yes, I agree, but we don't have one now.
Okay.
Okay.
Thank you, Amy and Rob, so much. As they both said, I'm going to send an email to all of you guys in the morning with the recording, the slides, all sorts of information. If you have a question that wasn't answered today, we want to make sure we can answer all your questions. So just email one of us. We'll get a response to you soon. But I want to thank you all so much for being here today. And it was a long session. So yeah, thank you all so much. Emmanuel, anything before we end here? Are we good to go?
Thank you, Maddie. Thank you, Dr. Marlon and Amy, for walking us through the update on the PPA. So, and I want to say thank you to everyone that stick around to the end of the program. As Maddie said, you'll get some update for us. If you have questions, keep sending them to us. We'll do our best to provide the information we have, and we will keep this program rolling. Hopefully, we can meet some of the timeline we share with you this evening. Thank you.
All right,
Thanks,
thank you
everyone.
all. Have a good night.
Thank you very, very much.
Good night, everyone.
Good day. Thank you. Thank you.
But do you have artificial intelligence, another program, ABM?
You can end the meeting. You're the host.
I'm going to stay on of Rob and Amy to debrief. So let's see who else is still here. People are dropping off.
I think we should end it and then we can get back on the same link.